The Brain Tumours Award, as we heard from Gerald, is funded by the Brian Quilty Memorial Fund and the Phyllis Edith Charter Estate. And this year the recipient is Dr. Iwan Bennett from the University of Melbourne and Royal Melbourne Hospital for the project Vascular Biomarkers in Brain Cancer.
Thanks, Professor Kiernan, Your Excellency, Gerald and Tony. I'm honoured to be amongst the other recipients of a Brain Foundation grant. One of them mentioned earlier, looking at models of nervous tissue. I think a good model is to put me in front of a microphone. I become very nervous, so I've got some notes here. So my research is on glioblastoma multiforme, or malignant brain cancer, and historically this has been a very devastating disease, as we've already heard. A little over 10 years ago, the majority of patients died within 6 months of the diagnosis. Now, thanks to research conducted in the field, a great deal of progress has been made, and average survival is now double that. Unfortunately, this is still only amounting to 12 to 14 months, and so there are clearly many obstacles to overcome. One such obstacle lies in the way we currently diagnose GBM. Though two tumours can look identical under the microscope, they can behave very differently and respond to treatment in very different ways. And if these tumours are thought to be regrowing on follow-up scans, one of the only ways to currently confirm this is to subject the patient to another operation and obtain biopsy of some tissue. The Vascular Biomarkers project hopes to identify simple and non-invasive tests that will help to more clearly characterise these tumours and help doctors in choosing the most appropriate treatments for their patients. It will also enable doctors to more closely follow their patients' progress and confirm whether the tumour is responding to the treatments or if instead another treatment should be tried. Such tests that are currently under investigation include a blood test looking at cells responsible for the tumour's blood supply and an advanced MRI technique called perfusion imaging. So on behalf of myself and my collaborators at the University of Melbourne and the Royal Melbourne Hospital, I would like to thank the Brain Foundation for this generous funding, without the likes of which the continuation of our project would not be possible.